Hi, everyone. My name is Katie Brumfield, and I am the Colorado School of Public Health Career Services Specialist. And today I am talking with Leslee Warren. Leslie graduated from our school in 2016 with her Master's of Science in Epidemiology. Hi, Leslie.
Hey, Katie.
Thank you so much for joining us today. Could you start off by telling us what your current job title is and where you work?
Yes, definitely. Well, thanks so much. I am working currently at Tri-County Health Department, and I work on I'm a communicable disease epidemiologist on their communicable disease epi team.
And can you describe a typical day in your role, or maybe even larger projects you're working on?
Yeah, definitely. I think for our communicable disease team right now, we're basically a team of 6 or 5 with our manager. And we work on a variety of things, but I'd say majority kind of day to day, we're in the office, usually as a team. We're right down each door from each other. So it's really helpful. And then occasionally we are also working out in the field, whether that's at restaurants or on-site childcares, or sometimes if you have to be at a hospital or working with our homeless shelters or providers. So I'd say majority of the time we're in the office, and kind of our everyday structure is pretty routine, but kind of day to day, these things change. Each day itself is very variable, but it's a combination of, we're doing case investigations every day for all these different communicable diseases that are reportable here in the state of Colorado. We're doing outbreak investigations, we're doing data surveillance, data projects, report writing, and then working with partners as well. So I think it can kind of just depend on what is high priority for that day. I think different communicable diseases, depending on what they are, require different follow-up and maybe immediate attention. So for us, I think is a lot of being able to kind of just adapt on the fly, picking up things, putting them down as needed, revisiting them. And then every day it's really nice. We work not only closely within our own communicable disease team, but we consult with each other, we bounce ideas off, we coordinate efforts. But also what I really like is we work very closely with other divisions within our agency. So whether that's our environmental health teams, our nursing teams, obviously other public health agencies like our state health departments or the other local public health agencies, or a lot of external partners as well. So I like it. It's a variety of things to keep us interested every day. And obviously the overarching, the big thing that we've been working on is COVID. Definitely over literally the past, almost 18, 19 months is when we started our agency response. But other than that, when we're not doing COVID, I think we do our day-to-day work, but a lot of us really enjoy data when we can. So it's trying to figure out and trying to get back into the swing of things, of what kind of bigger data projects, to looking at our surveillance data, maybe looking at different factors and determinants based on the variables we find. So I'd say that's, in a nutshell, kind of a typical day in the office.
What data software systems do you use most regularly?
So we have a couple different like surveillance systems we use. Obviously, everyone's probably really familiar with the Colorado Electronic Disease Reporting System, CDERS. We also have new ones that they built just for COVID that we're using. I mean, Excel, we use a lot. And then just depending, others of our colleagues, I mean, we're using SAS when needed. We use EpiInfo when needed. Sometimes for our team specifically, we don't have massive data sets, so we can do a lot of what we do in Excel or EpiInfo, and then we try to use SAS when we can as well. So I think those are the main ones.
I like to ask that because I know there's so many out there, and I'm just so curious on what people use.
Oh yeah, I think. Oh, and I think a couple of us, when we can, use R just to keep our skilled up. But yeah, it's pretty manageable day to day.
And could you tell us about your career path, how you chose a career in this?
Yeah, when I started the program at CSPH, I didn't know much about epidemiology. Like I knew generally what it was, but I didn't know like research versus applied epi and kind of what that meant before attending. But for me, I think the coursework I received through CSPH and the program was like exactly what I needed for a really strong foundation. I obviously learned a lot on the job, just understanding the intricacies and the specifics of applied epi, but I think all the classes and all the coursework between the epi classes and the research methods and the biostats courses just helped me build my skills. And so through that, most of that time, I also worked at the Colorado Food Safety Center of Excellence on campus with Dr. Scallon, and then with the CSPH. And I think that was like so beneficial, because I think that was that additional piece. I know that MS is a little bit like research heavy. So I got that. I felt amazing having that research piece, but also being exposed to the applied epi arena and world, and being able to work with people from the state health department. And it was kind of a perfect mesh of what I wanted to do. And that's how I really, just through those experiences and talking to people, I was able to kind of prepare for this current job. And I felt like coming out of that program, even though I didn't know much about like the agency or what exactly I'd be doing, I just felt confident that I could actually be part of this world, this larger public health world, and maybe find my place there.
Yeah, that's awesome. Could you tell us the difference between the MS and MPH? I know a lot of people sometimes can struggle between which one should I do. So what was your experience with the MS and the differences?
Yeah, and I apologize if hopefully I don't butcher it. This is at least where I remember. So they're very, very similar. I think majority of people I was with in my cohort, my friends, I think majority of people were doing their MPH and then their concentrations either in epidemiology or stats. I think the big difference with the MS was that, for the MPH program, you do kind of each of those intro courses. So you do the intro to like policy and HSMP, all of that. And then MS, you kind of you get straight into the epi sequences. And so a lot of those additional electives, so like chronic disease epi and infectious disease epi and injury epi, that were electives for MPH, those are just built in the curriculum with the MS. And then I think the MPH, you obviously do your practicum and the capstone, and then the MS, you do just your thesis. So it was very similar experiences, same biostats courses. I think maybe, I can't remember the names. I think maybe the biostats were you can choose when you're in the MPH program. I think it was pretty set for the MS. But I think a lot of the same experiences, I don't think people can go wrong either way, really.
I agree. And from what I hear, but again, I could be kind of wrong too, is it's just more data research focused in the MS. You get more of those skills.
Yeah. I think that was similar. Just the thesis was awesome for like learning, definitely sitting down and doing like a big paper and having a longer term project. So I really enjoyed it.
What was your thesis on?
It was, I worked with one of the providers. He's incredible. He was one of their ED providers over at Denver Health, Dr. Hocus. And he had been doing kind of longstanding project and trial for offering HIV testing within the emergency department setting. And so he had collected all this data from both survey data of all these patients that had been offered testing, and then really looking at different determinants as to why people would accept HIV testing in the ED setting or why they wouldn't, and really breaking that down to different social factors, demographics. And they were using basically this risk score that they had developed, and basically assigning based on all these demographics, really looking at if a person's inherent risk for HIV had any influence on them wanting to get tested or not. Yeah.
Wow, that's cool. Great.
Really? Yeah. That's amazing. Yeah.
What advice would you have for any student, current student or prospective student that would want to pursue a career that you're in?
Yeah, I think I would just tell them, I learned so much, and I guess my big takeaway is that no experience is too little experience. I'm still learning in this world of epidemiology, whether it's applied or research, how big the field is and how much you can do with it. There's so many incredible epidemiologists out there, and there's so many different areas of study, or every health department works differently. They're operated differently, they're structured differently. And so I think, when you come out of grad school, you have most people have a very similar set of skills as your classmates. So really taking every opportunity that you can, and knowing that the first job you hop into out of grad school might not be your final career, but it's an incredible stepping stone. So really just to get out there, talk to people, learn more, and then knowing that you have time to ultimately figure out where you want to be. So I think that's the biggest thing I've learned. I just feel I've loved every experience, and I've got to work with a lot of people. So
Yeah.
it's definitely worth it just to, you know, and even if it's not like epidemiology directly that you're doing, I think a lot of
Sure.
those skills are transferable to what you learn at CSPH is, so you can figure out where you fit in eventually.
Yeah. 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 And I think that's the cool thing about public health is you can move around
Yeah.
in the field. So I think that's really nice. One thing I forgot to ask you is what are some challenges you've faced in your career or in this current job title?
Yeah. Well, I scribbled down, COVID was
Yeah.
obviously a huge challenge, I think, for all of us.
Yeah,
Whether
that's
I was talking to my coworkers who've been around, you know, in public health for decades, and they said, obviously, this is kind of unprecedented. Even she was saying different than H1N1, which was a huge,
yeah.
huge operation. But that was really interesting because I think of the agency in public health, we were used to doing like big responses, like for emergency responses, like hepatitis A, when we have big outbreaks, or measles or anything, but it's usually like limited, like there's an endpoint. Whereas COVID, I don't think any of us knew. So it was
Yeah.
like, everyone kept saying it's kind of like building a plane, like while it's in the sky. Is
Oh gosh.
no one really knew. It was so unprecedented that there really wasn't a structure. So I think that was a huge challenge. But it helped, I think, us learn a lot and grow. And we got to work with the different agencies and our different partners and our different divisions in a way that has been so different than before. So I think it's been a challenge, but a really great opportunity for growth. And then I think other things I've just learned a little bit more about, more peripherally, it's kind of over my head still, is definitely just navigating political changes is a huge one. And I didn't realize that going into it, that, you know, changes in the administration or they can really have a trickle down effect, whether it's federal or state or local level, that really affects a lot.
Wow. Yeah.
And then I think the other one was just learning, one of our professors at CSPH, Dr. Johnston, he was the former executive director over at Jeffco. He described public health as kind of like the sewer system of a city, which is, you know, it's so important. You have to have a sewer system, but no one really thinks about it. No one knows about it. No one wants to even fathom it until something's gone way wrong. So I think that is an interesting challenge, just helping people navigate the world of public health and they don't really know. And us trying to navigate it as well, to be like, this is what we do. You know, it's not the most glamorous sometimes, but I think it is really helpful. And maybe
it's so important.
Yeah.
I'm sorry, what'd you say?
Oh, and it's just like maybe, and you know, good or not, I think COVID has maybe brought that to the forefront a little more.
Yeah, definitely. I mean, it's public health is now finally talked about a lot more. But I loved that analogy of the sewer system because you're totally right. Like sometimes it's hard to explain to people, you know, because there's so many things you all do and learn. But they're so important. I mean, for everyone.
Yeah. I mean, usually by the time you hear about it, you're like, oh my God, something's, you know, the sewer system, something's awry in the system. And then that's why. So definitely interesting challenges, but at least for me, have been like really valuable and necessary. And I've learned a lot and continue to still learn a lot every day.
Wow. Yeah. Thank you for sharing that. That's really, I feel like that really explains it, you know, like it helps understand. I haven't heard that before, so I really
I was like, when he said that, I was like, oh, I think so much sense.
I was like, oh wow, that's perfect. And then thus far in your career, what would you say is your biggest achievement or the thing you're most proud of so far?
Gosh, I think that what I'm most proud of is getting to probably every day like work with such an incredible team of people and be part of an agency that and a bigger, not just Tri-County, but you know, going up to our state health department and our other partners at our other local public health agencies. I feel really proud to be able to work in an environment where there's so many people who have like a shared common goal. Like really value people and they value individuals and they value their communities, and we're all just trying to figure this out together. But there's so many like smart people and we get to work with them every day in different capacities. So I think that's what I'm most proud of, is just being part of this bigger system, and to keep everything together. And then I think obviously working in COVID in a slightly different role than I'm used to, I guess has been a really awesome opportunity in itself, to just kind of have to expand ourselves and get out of our comfort zones and learn something new. So I think day to day, that's what I most enjoy.
Yeah, that's awesome. Thank you so much for sharing your current job and advice with us today. Is there anything else that we didn't talk about that you want to mention in your job, or if anyone's interested in pursuing a career in epidemiology, anything?
Maybe I kind of mentioned I came into the program very unprepared, like very unprepared. I swear I didn't know anything, but I think that happens a lot from coming from undergrad.
You came right from undergrad?
I did, yeah.
Yeah, okay, cool.
I did my molecular bio, and I think this happens a lot to people go into sciences in undergrad, is that there's I think people see two options, either lab sciences or med school. And there's so much more out there that I didn't realize. So I feel really lucky because I kind of fell into this. But I think just for me remembering hey, there are other options to explore, and to, for people who are looking into it, just go for it. And then just know that there's, once you kind of walk into that world, you start to see, even just everyday interactions with other people, you're like, oh, I like what you do, or I like what you do. So start that conversation early. It's been really beneficial.
Yeah, absolutely. So I'm just curious, how did you find out about public health?
Oh my God, it's so embarrassing. I was as a senior in college. It was my winter spring semester, and I was like, oh my God, I'm going to graduate. I guess I'm graduating. And so I was thinking about what I need to do next. And I had worked in a lab for 4 years, and I knew I really, bench sciences, the research aspect was so interesting, but I knew I didn't really want to continue doing that. And med school at that point, I was like, I don't really want to do that. So I was taking, it was a bioethics course, and we literally watched Contagion, as most people do, I feel like.
Yeah.
And then we were watching it, and I was like, oh, this is this sounds interesting. And then just started doing a little bit of research, poking around, typed in what is epidemiology, and then found school, and then saw that CU has its own program, and then literally just applied the night it was due. And I said, come on. And then I get which is why I feel so lucky that it worked out.
Yeah.
So had I known, I should have started earlier. And that's what happened. But I knew I really loved research, but I wanted to work with more people. And so when I started doing a little more research, that was this was kind of a perfect combination of that.
Yeah, it definitely is. Well, that's a good story. I'm glad I asked. All right. Well, thank you so much, Leslee. And thanks for all the hard work you're doing in public health.
Awesome. Well, thank you for having me. It's great talking to you.